So I'm proud to announce that this was selected by the SIR as one of the abstracts of the year, which really reflects the compelling data from this multi-center prospective global trial. And I think you can sum up some of the headline findings by the improvement in pain and quality of life as early as 3 days, so very rapid, and the lack of delayed skeletal events, meaning things like fractures or neurologic injuries.
The significant decrease in pain scores that often were noted within hours to days of this procedure was pretty startling. I mean, we always had a good effect with vertebroplasty, but this was pretty dramatic and quite quick in terms of its efficacy. And the maintenance of alignment on imaging when these patients were evaluated several years down the road, usually just for cancer surveillance. And so we found that quite impressive because not only did it address the immediate concerns with pain, but it also maintained alignment and progression of fractures and deformity and creation of new pain with arthritis and malalignment. So we were quite pleased with that.
For quality of life, we looked at both pain interference, which is basically how much the pain interfered with a patient's daily activities, and finally the EQ5D scores, which is a quality of life score. And what we were able to see is that the quality of life was significant both at the 3-day time point, which is really important, obviously, but more importantly, or equally importantly, it was sustained. So we saw that both the rapid improvement was sustained in the majority of the 59 patients that reached the 12-month time frame. This really should move the needle more. It is already in the NCCN guidelines that RFA should be utilized in this patient population, especially in those like the inclusion criteria from this trial, which includes anyone with a lytic component. I think the main impacts were the speed to recovery, so rapid relief as early as 3 days, which when you compare it to radiation oncology is much faster. The second compelling argument is that it was sustained at 12 months. And equally, if not more important, there were no skeletal related events. You will never see that in a radiation oncology trial. And we know that skeletal related events lead to worsened morbidity and actually worsened mortality in this patient population.
So standard of care 10 years ago for cancer-related fractures was often SBRT, bed rest, and opioids. And if the patient had a pain flare post SBRT, they would be managed with steroids and analgesia for many weeks, and the pain would subside. Hopefully, if it didn't, they would stay on bed rest. It did not prevent deformity from continued fracture. It did not maintain alignment, and it often resulted in a poor quality of life, especially if they had prolonged bouts of bed rest, steroid use, etc. And if they sustained post-SBRT fractures, there were surgical options or vertebroplasty or kyphoplasty alone. RFA-assisted vertebroplasty seems to give almost immediate durable pain relief. It's safe to do paired with many other local regional techniques, including SBRT. Bipolar RFA is easy to adopt into most oncologically driven practices. It has clear advantages in terms of immediate sustained pain relief, and it should be considered either with or without SBRT, depending on your center and practice preferences. What modality is best is really yet to be determined, but RFA-assisted vertebroplasty has the advantage of producing almost immediate pain relief in one session versus multiple sessions for radiation. It has no pain flare, and with COVID, these reduced trips to the hospital for treatments has definitely been a significant advantage.
The key takeaway messages from the abstract and the findings of the OPuS One trial final cohort are really three things. One is speed to recovery. We've really not seen this before, where we've had improvement in quality of life, in pain interference as early as 3 days. So that's very, very impactful. The second thing is going to be the lack of complications. And really, when we're talking about complications with musculoskeletal metastases, we're talking about skeletal related events, namely fractures. So that's really important, leads to improvement in morbidity and mortality. And then finally, the key takeaway message is these results were sustained. So we were able to follow a decent portion of the patients up to 12 months and saw that the results continued to improve in this patient population.